Thanks, Brad. New concerns today from Ohio public health experts as a statewide outbreak is declared for a dangerous virus.
Liz Bonus joins us with how to protect against it. Liz.
Hey guys, good afternoon once again. That virus, Hepatitis A, a disease which under a microscope might look like what you see here, courtesy of the Ohio Department of Health, but it also causes serious health complications. You can see in that part of the photo, someone's got a little liver over it, right in your liver. That's the damage. Already several states around us, including Kentucky and Indiana, have declared outbreaks of it as well. Today, the Ohio Department of Health declared a statewide outbreak and released this map. Now, the dark blue areas have a higher outbreak, and that's Butler, Montgomery, and Hamilton counties with numbers between 92 and 267 cases. They've been investigating an increased number of cases of hepatitis A since the beginning of last year. You can help prevent that with a vaccine. It is spread when a person ingests fecal matter, even in microscopic amounts from contact with food, objects, or drinks contaminated by the stool of an infected person. We talked to the team at Health Source of Ohio today in Mount Washington. They said this is what we need to know to protect against it.
The main thing would be washing your hands, making sure that if you are sick to kind of not touch anyone, you know, the normal standard precautions, washing your hands, covering your mouth when you're coughing. It's kind of hard to say for Hep A, I mean, because it spreads through fecal and oral, so more stools and contaminated waters.
Those are really important things to know. Hepatitis A can also be spread from close personal contact with an infected person. And those at risk include people who are homeless, those in prison, those who use drugs, whether injected or not. Symptoms include fatigue, low appetite, stomach pain, what they call clay-colored stools, and jaundice. And you can spread it, unfortunately, before you're sick with symptoms, which is why it's so dangerous. If you have these or know someone who does, they say see your doctor, get tested. And if you were exposed, which is why they want to get the word out, you say, oh, I know I work with that person, or you know, I ate at that restaurant or something like that. If you go and get the vaccine, it takes about 2 weeks, but it'll help you not develop many of these complications that can come. So that's why we try to let people know about it.
Okay, so if you take the vaccine, are you good for life or only during that exposure time?
You are good for life with some thought that you may need a booster in you know, years and years.
Sure.
So maybe something to consider since we're all out in the world.
And there are some schools now starting to look at that and have it a mandatory
as
vaccine.
a preventative thing.
Okay. Where, and there's, you know, we don't hear much about it because vaccines have sort of done their job.
Right.
And now there's been sort of a resurgence in our community, so we're paying a lot more attention.
Okay.
Which is a good thing.
All right.
You know how I feel about
I know, the germ thing. So speaking of that, we'll be back at 5:30 to share whether you know it's a respiratory infection or whether it's really the flu, because that's what's going around right now. All right?
Okay.
See you then.
Thank you, Liz.
All right, thanks.